This segment of Delmarva Life is sponsored by Delmarva Dental Services.
Braces. For some teenagers, it's just a part of growing up. A few years of metal in your mouth that leads to a nice smile as an adult. But orthodontics do so much more, and they're not just for kids.
Yeah, orthodontics can be life-changing for adults dealing with everything from a crooked smile to pain. In other words, it's not just a cosmetic solution. I recently stopped by Delmarva Dental Services to learn more. Sometimes an oh wow smile is achieved with braces or other orthodontic work. But it's not always just about the smile.
Orthodontics is so much more than just how your teeth look.
Dr. Lee Aki of Delmarva Dental Services says, while it's a big part of what people want to accomplish with orthodontics, there are many more benefits to boast. For one thing, crowded or overlapping teeth can be difficult to clean.
You'll find that it makes the home care regime more difficult. So if it's hard to access to brush, if you get a lot of food stuck between your teeth, if it's hard for you to floss, some people just go, I don't feel like dealing with that hassle today, and they don't do it.
That, of course, can lead to tooth decay or gum disease. Crowding can also create an uneven smile.
An uneven smile is something that people typically cosmetically don't like the appearance of because it can almost make their face look asymmetrical. And so orthodontics can help to correct that. And sometimes that's necessary in addition to cosmetic dentistry to resolve other issues that a patient may not like, such as the shape or the color of their teeth.
Another issue orthodontics can correct is something called malocclusion.
It's a fancy word or the dental word for the way the teeth bite together improperly. So occlusion means the way the top and bottom teeth come together. A malocclusion means they're not coming together in an ideal way.
The most familiar classification of malocclusion is an overbite,
meaning that the lower jaw is retruded. The other would be the underbite, where the lower jaw is forward. And then we have our more ideal bite position that typically results in a more functional and a more stable biting position for them.
When only the back teeth touch, but not the front, that's called an open bite.
Which means the back teeth or that hinge area takes a lot of force. And we see more patients who wear down and break their back molars because those are the only things touching when they are functioning.
Dr. Aki says an open bite can occur naturally, or it can form as a result of habits such as thumb sucking or tongue thrusting.
They may also have more joint pain or discomfort because they have very little places that can actually chew and function properly.
Conversely, a deep bite is where the top front teeth close entirely over the lower front teeth,
which can result in significant wear, shortening of the teeth, which can be uncosmetic in appearance, and also breakage of front teeth, which is certainly a concern for patients.
A crossbite is caused when the teeth on the lower jaw are wider than the teeth on the upper jaw. It too can cause tooth fracture and joint pain. Dr. Aki says these conditions are usually caught early in life.
However, it doesn't mean you can't correct some of those things as an adult, but the earlier intervention does tend to set up a better lifelong situation for function and overall oral health.
Another issue has been linked to sleep and breathing problems, even ADHD.
A high palate and a narrow arch or very skinny upper teeth, which usually is also associated with crowding, can be the result of things like thumb sucking, pacifier sucking, other habit. However, the higher up that arch gets, the more it affects the sinuses and the nasal cavity, and you may experience more difficulty in the way of allergy issues, sinus issues, breathing issues. It can even be related to sleep disorders and ADHD in children.
Addressing issues beyond straightening teeth, giving patients something more to smile about. And the dentists at Delmarva Dental Services can see if there is a problem developing in patients as young as 6. Some of the approaches used on young children may even eliminate the need for braces altogether.
I'm sure they'd be happy about that too.
Yeah, absolutely.